The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us this evening. We'll be starting our presentation in just a moment. We do have a couple more folks that are getting logged in right now, so we're going to give them a chance to join us. It's 7:02. We'll be starting the presentation in 2 minutes. So at this point, everyone should be able to see our screen right here. It is the first presentation slide that just discusses that this will be covering our global health programs. If you are having any visual issues, any black screens, you can feel free to type into the chat menu and let us know if you're not able to see the presentation start. Thank you so much, and we'll look forward to talking with you soon. All right, well, thank you everyone for your attendance this evening. My name is Angelica Santiago. I'm an admissions officer here for the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. Tonight we'll be discussing our Global Health graduate program. Joining us tonight will be Dr. Bill Brieger, Director of the Graduate Global Health Programs. Myself, my name is Angelica Santiago. I'm the admissions officer for the online programs. We work with our team here to assist students as they are exploring their options for continuing education. I have been working in online higher education now for the past 6 years, and about 3.5 of those years has been with Johns Hopkins University. So excited to be presenting with you tonight. Dr. Brieger, can you please introduce yourself?
Hi, yeah, I'm Bill Brieger. I'll be teaching several of the courses you'll take if you do enroll in our program. I've been affiliated with Johns Hopkins since the 1990s. Actually, between 76 and 2002, I was teaching at the University of Ibadan in Nigeria. So much of my concern about establishing these global health courses is to meet the needs for continuing education for health workers in low and middle income countries. So we hope to recruit a number of those. I've been teaching online with Hopkins since 1996.
Perfect. Well, thank you for that introduction. So just to give everyone an idea of what we'll be covering this evening, Dr. Brieger is going to take us over the industry overview, really discussing why there was a need for these specific programs. So giving you an idea of where individuals who are coming into this program can look to apply those skills and the knowledge that they're gaining. He'll also be going over program details and curriculum. So looking into a little bit more specifically into our curriculum, what sets it apart from other programs, looking at specifically what you'll be gaining, the foundational year of the program, which does focus on the foundation of global health practice, which is also our certificate that we do offer, and then looking more at the curriculum for our 2 different global health programs. He'll also give you some insight into who our faculty are, their backgrounds, very active practitioners in the field, so a little bit of an idea of who you'll be learning from and what their specific focuses have been in their academic and professional careers. This is an online program. Both of our master's degrees as well as our certificate are fully online. So Dr. Brieger will give you an insight into what it looks like to be in online learning here at Johns Hopkins University. If this is new to some of you, don't worry, it's not new to Johns Hopkins University. It's definitely something that we have been in online for over the past 20 years. So get ready to hear some information about what the resources are there. I will then go into our admissions requirements and along with our financial aid and tuition information, some details about the scholarship that we do offer through this program. And then we'll be saving time for a Q&A session at the end. So please feel free as you're listening to the presentation and you have any questions that come up to go ahead to type them right into the chat box. We'll make sure to cover those at the end with Dr. Brieger. So thank you so much for your time and enjoy.
Okay, one thing we like to make a distinction. Our department is called the Department of International Health. There are other programs and departments in schools of public health around the country and around the world called Global Health. We were established over 50 years ago, and the idea of international health is concerned with looking at health systems in all countries at all levels of their development, and it's very much a comparative process, and also it's learning what we can learn from each other. So the idea of international is important. Global, of course, enters into the picture because it takes place throughout the world, but we do want to emphasize this importance of looking at and learning from systems, learning from each other. Also, our programs are built on the Alma Ata Declaration in 1978. WHO and UNICEF pulled together representatives from throughout the world to define primary health care and set goals for health for all. This has been a major challenge. It doesn't mean everybody is guaranteed high-level health care, but they're guaranteed quality health care, appropriate health care, accessible health care, or universal health care as WHO has later come to define it. Recently, the WHO and UNICEF pulled people back together 40 years later in the same country, Kazakhstan, where Almaty, which was then called Alma Ata, is located, but this time it was held in the new capital, Astana, to recognize the new 21st century approach to primary health care. Fortunately, I was among some of the delegates from our department to attend and learn about the commitment that countries have to reach everyone down to the grassroots. So these are some of the issues that we'll be bringing into our courses. We've selected the courses specifically to introduce you to these important factors: the health sector, the health systems building blocks, and how we can overcome some of the inequities both within countries and between countries. So again, like I said, our department's over 50 years old. It was the first academic program in international or global health. So clearly there is experience there. The mission of the department is seeking an understanding of health problems and develop appropriate solutions, interventions to reduce these problems, especially for underserved populations around the world. Some people have asked us in terms of applicants, well, what if you've not worked in a low or middle income country? What if you're based in the US? And there are people based in the US or Europe who are serving underserved populations, urban slums, Native American or First Nations populations, immigrant populations. So regardless of where you are physically in the world, you can benefit from these courses if you are working with underserved and disadvantaged populations. To achieve our department's mission, of course, we conduct research, which you would expect from an academic institution, but we educate scientists and health professionals. So we have PhD programs, but we also train students at the master's level, including people in the Master of Applied Science program who are actual practitioners and professionals who will implement programs through development agencies, through health agencies on the ground. We work in the area of health policy, public health practice, and we're particularly concerned about institutional capacity building. again, what we see our mission being carried out through the OPAL programs, through the Master of Applied Sciences and the certificate programs, is building capacity of people who are either based in low and middle income countries, who are going to be serving those countries through various NGOs, and also, like I said, people who are working with underserved and disadvantaged populations throughout the world, whether it's in Europe or Africa. So our graduate programs generally, and the online programs specifically, prepare people for global health service. We intend that our students will manage health initiatives, whether that's at the community level, the district, subnational levels like states and regions, national levels, and even working in regional agencies. So we train people who either are working and are taking leave of absence or study leave, or who intend to work in agencies such as the U.S. Agency for International Development or the British Department for International Development. We're particularly concerned about organizations that are operating in low and middle income countries. These may be government organizations like ministries of health. They may be NGOs, faith-based organizations and faith-based hospitals and healthcare services, military branches, NGOs, both international NGOs and local NGOs, as well as primary and secondary healthcare clinics throughout the world. We do try to focus on, one, educating our students about, but also training people who could eventually work in agencies like the Global Fund, like UNICEF, like the World Health Organization. So from experience with our existing online programs, we find that many people take that opportunity for online learning because they may not be able to get leave of absence from their work, but they can take online courses while they are still employed by some of these agencies so that they can improve themselves and be, then be a valuable resource within their own NGO or international agency. Okay, so again, we're talking about skills to look for health solutions and health in the context of development. We recognize that sectors like agriculture, education, women and gender, those kind of sectors contribute to health. And so we work across sectors, we work across borders. I do a lot of work in malaria and recognize that mosquitoes and human migrants don't always respect borders. And so diseases and health problems don't always stay in one place. So we need to have a wider view of our health situation. Okay, we start with our graduate certificate. And this, again, sort of was the beginning of what we were doing. We started an online certificate in the department about 10 years ago, and people were applying for that and taking online courses, but it became more expensive for them. It became more challenging to complete, and when the opportunity to start the OPAL program came up, with a better price structure that we'll be talking about later, but also completely online, we were aiming to reach more people. So the new graduate certificate program that we have under OPAL gives you, at a lesser cost, 25 term credits in one which you can take in one academic year if you wish, compared to the 18 credits we had in the previous certificate. But we did get into the certificate business 10 years ago, trying to reach people in, early and mid-career professionals in low and middle income country settings. So once, as Angelica said, we do use the certificate as year one as a foundation for our two master's programs. Even you can enroll in the master's program for the and get the certificate after you finish the first year, or you can take the certificate alone, or you can take the certificate and at the end of that year decide you want to go on to a master's. So these are some of the courses. We have it arranged such that at least 2 courses are available every term. The reason for that is that students who are U.S. citizens are eligible for student aid if they take 6 credits, academic credits in a term. Now, as with all of our online education in the school, there is no rush to finish. If you are not worried about getting student financial aid, but you want to take it at your own pace, you can take 1 course a term. You have up to 3 years to finish the certificate, which is 25 academic credits for these 8, 9 courses, or you can, spread it over 3 years. This is a choice of you. But in the first year, we do get all of our public health and global health basics. The public health with our statistics and epidemiology, the global health basics in terms of the introduction, the fundamentals of global health, the issue of public health ethics, global health ethics, we have our own global epidemiology focus course, and we also look at, in the first year, the social and cultural basis of primary healthcare programs. So that's your foundation and that's your certificate. Okay, then we divide and people can apply for the planning and management track, and getting the master's in global health planning and management means that you will take courses that are preparing you to function as a manager in an NGO program, in a Ministry of Health program. We'll look at policy issues and management issues related to a number of things, such as pharmaceutical management, because programs need commodities in order to function. We have courses like the Frameworks course that looks at the health system in general, introduces you to that and how it works, the different components. As you know, WHO has 6 basic building blocks for health systems, and we consider that. We look at quality management. We look at systems. We look at we have opportunities to look at health information systems. Data is very important in terms of measuring the success or identifying challenges in program implementation. We specifically have a course on managing NGOs, which is very important in the public health field and global health. And finally, just like all OPAL courses, we end with an integrative activity where people will do a defined project that will try to pull together the things that they've learned throughout the 2 years. Our second track looks at community-based primary health care. Again, based on the concepts of Alma Ata, where we're working at the grassroots, mobilizing communities, working with communities, encouraging communities to take charge of their health. And so in that context, how are communities going to manage their own essential medicine supplies? How are we going to evaluate these community-based programs? What about, since the world is urbanizing quite quickly, how can we apply primary health care in an urban setting? We look at survey methods to learn from the communities and to help with our evaluation. We have programs on training health workers. We talked about capacity building, so you will learn something about how to establish appropriate community-based training programs. Again, with this and all the OPAL courses, master's courses, we will have our integrative activity at the end. But basically, the second track looks at developing your understanding of how to develop the capacity of communities and frontline health workers to deliver primary health care at the grassroots. Okay. So quite a number of people are involved in teaching our courses. These are all regular faculty who are on, board in Hopkins. Dr. Baki and myself teach the course in urban health. He's a specialist in maternal and child health, has done a lot of work in Bangladesh. Mariah Merritt does our teaching in ethics. This is one thing that's extremely important, to base our interventions on ethical treatment of people in the community. Rosemary is involved in our course on understanding health systems. Gil Burnham does work with primary health care projects. So Dr. Henry Perry has spent quite a lot of time throughout the world in Latin America and Africa developing community-based primary healthcare programs. Tim Robertson teaches our course in NGOs. Anna and myself also teach the foundations course, and Anna, Alan, and Summer are involved in our global epidemiology course. So we have quite a number of people involved. Basically, I'm the director of both of the master's programs and sort of the here to answer any questions, emails, challenges that students have, apart from what cannot be answered by the individual faculty. And of course, I'm assisted by our admissions and counseling staff, such as Angelica, to respond to your various kinds of needs. Okay, and Christine Salazar is our program assistant that helps me make sure that everything runs smoothly, that helped us get the whole thing approved in the first place. So as was mentioned, the school itself started online learning. Probably, I think the first courses were offered in the mid 1990s. We had some short courses online for CDC, and we later expanded that and offered an online version of the MPH program. We have now an online DRPH program and an online, of course, all the OPAL programs are online. So we have quite a portfolio of online learning. We have a Center for Teaching and Learning that provides high quality production capability to help us with our planning and recording and scheduling of all of our lectures. We try to design our courses such that there are activities that engage students throughout the program. Again, it's very important for students to take advantage of these learning from each other experiences because we do set up opportunities for people through discussions, through projects to interact with each other as well as with the faculty. So again, everything is recorded, so it's flexible for the student to listen to lectures anytime. Of course, being online does require a little more discipline than attending a regularly scheduled class. Yes, we both online and on-campus courses run for an 8-week term. An on-campus course will meet, 2 or 3 times a week at a set time and a set day. But for the online courses, all the lectures are available for when you want to listen. And so we have, of course, most people will try to spread it out and listen to something, every day. Unfortunately, there's some people that hold off for a couple of weeks and then they get behind in their assignments. So it does take a little bit of discipline to do an online education. Fortunately, on the technical side, we have a help desk that can, if you're having trouble accessing lectures, if something doesn't appear that's supposed to appear, you can write to our helpline through email and you get pretty quick response. And then again, for other kinds of issues, we do have counselors for help with other issues, non-curriculum, non-technical issues.
Perfect.
So turn this over.
Yeah, thank you so much, Dr. Brieger, for all the insight into the different parts of the program, breaking down a little bit more about the certificate and the 2 master's degrees. I'm going to take some time and go over our admissions requirements. If you are interested in moving forward, it's important to know what you need to know about admissions, the application process. All of our applications are processed through SOPIS and SOPIS Express, so it's an online application portal meant to streamline your application process. The 2 master's degrees, the application goes through SOPIS, and SOPIS Express is specifically for certificates. The requirements as far as education is that students do have at a minimum a bachelor's degree from an accredited college or university. And a minimum of 2 years of experience is the professional requirement, specifically experience post-bachelor degree, health-related, focusing primarily on health-related experience in low and middle-income countries or underserved populations. Dr. Brieger gave some examples of that earlier in the presentation, talking about the different backgrounds of students who can and have come into this program previously. We do require a current resume or CV to be uploaded into the online portal. For applications for the master's degrees, 3 letters of recommendation are required. And for the certificate alone, you are only required 1 letter of recommendation. So 3 letters of recommendation for master's degrees, 1 letter of recommendation for certificates. The statement of purpose is a very big part of our application process. That is meant for you to be able to communicate to the admissions committee why this program, how this program matches up with your career goals, with the educational objectives that you're trying to fulfill, what you're trying to gain out of the program, and how you hope to apply it in your career and in your future. So the biggest thing that they want to hear from you is why. And don't be shy to express your passions for this area, for global health, and for making a difference. They want to hear from you about you and what your goals are. For our international students, those who have obtained education outside of the U.S., there is a requirement for a proficiency in English exam. We accept both the TOEFL and the IELTS. For your academic records, it is a requirement that you do have to undergo a course-by-course credential evaluation via the World Education Services. So as you can see, we've shortened it out for WES, which is how they are known typically professionally, but that stands for World Education Services. So I encourage you to review the WES required documents. That way you can see what they do require from your university and how your university should send your records to them directly. This is something that we're very used to working with students with here in the Office of Admissions. So if this is something that you need and you have questions about this, I encourage you to first reach out to us and let us talk you through and walk you through the process, and we'll get you connected to the right websites, the right resources, so you can start in that process. So looking over the admissions information, our application is an ongoing review period. So our application is currently open. It will be open until July 1st, and that will be to start this year, September 3rd. When I say an ongoing application cycle, we review on an ongoing basis. So it's a rolling basis of review. So you do not have to wait until July to hear back your decision. We encourage students to apply early so you can receive your decision early and really start properly planning for the fall of 2019 and starting classes. What does that look like for work? What does that look like financially? What does that look like for life? So to make sure you have time to plan appropriately, but applications are open through July 1st, then we are here to assist you all the way through every step of the way. So if you have questions or concerns on the application, you definitely have a resource and a support system with us. We do enroll 1 time per year, so it's important to know that if you are excited about this information and looking at starting this program, we have 1 start per year, which is always in the fall of each year. So as I stated, applications are open now. It will be to start in September of this year. Applications will then reopen in the late fall, and that will be to start in September 2020. So we have 1 start per year, but as Dr. Brieger mentioned, there is flexibility. So if you're interested in starting but not sure you can commit to a full course load, you're more than welcome to start 1 class at a time this year as well. So to provide some insight into a very important piece is the investment of school. Right here is listed all of our financial information, as well as some information about the financial aid office for those who are eligible to utilize other financial resources like FAFSA or looking at private loan information. You can feel free to look into our financial aid website directly or email or call them. The information is listed here. But for the 2018-2019 school year, tuition is $1,128 per credit. We have our Opal scholarship available for this program. It is a partial scholarship that will cover $433 on every credit, and that leaves students responsible for the remaining $695 per credit. Now, this scholarship is specific funding to these programs, to our Opal programs, which is the online programs of applied learning. If you are accepted, it is automatically awarded. There is not additional application or forms or anything for you to fill out. So if you're trying to plan financially, you're going to want to plan for the $695 per credit at the current tuition rates. Of course, our tuition rates are assessed in the late spring of each year. So in a couple weeks, we should be receiving, if we're going to have any updated information, if there's any changes to the tuition, that will be listed on our website shortly. However, the scholarship remains intact for next year, or any changes that will be made to tuition, you will still have access to that scholarship. So the range of $695 per credit is what you'd want to think of when you think of the investment and the commitment to the program. Just to go over the breakdown of credits again, the 2 master's degrees are both 50 credits at $695 a credit, and then the certificate is 25 credits at $695 per credit. And now we have time for our Q&A session. So we have a couple of questions that have already come in. Dr. Brieger, I'm going to direct the first question to you. It's asking, if someone does not have a previous academic background in public health, do they need to take any statistics or anything prior to be ready for the epidemiology and biostatistics?
Not necessarily. And also some undergraduate degrees also have some math or calculus or other kinds of courses that you do take. We do have a basic epidemiology and a basic statistic course in there. What I find is that sometimes our MPH students who may not have had a strong background do take, a couple courses before they start, and it does help them. We also offer some of these things on Coursera. And if you know how to get in there, you can either take it for credit at, I think it's 49 something dollars per course, or there are ways of taking some of these Coursera things free. But we do have a lot of statistics courses offered by Johns Hopkins on Coursera that, can also help people prepare.
Perfect. Thank you so much. I have a question that just came in that is more application specific that I can answer. A lot of you are curious if the GRE is a requirement for this program. Great question if you're looking at different graduate programs, but it is not a requirement for this program. So the GRE is not part of the application process, nor is it required or expected as part of the application.
But we do look at your transcript and hope that you have strong grades.
Absolutely. And going through SOFIS, if I point out, if you've never gone through SOFIS, what they do is they do give you an opportunity to break down, and they show a breakdown of all your grades. So they'll be able to look over all of your classes, all your previous coursework, the trends in your grades. So all of that will be noted to be reviewed properly. Dr. Brieger, we have a student that wants to know if you can expand a little bit more on the integrative activity for this program, for these programs, the master's degrees.
Okay, we are actually in the process of designing that, because we will not offer it until the 4th term of next year, because right now the students enrolled are our very first set. We are thinking about designing either a series of case studies that students can analyze using the different coursework skills and competencies that they've gained. We are trying to consider how we might have some more practical work. The challenge there, of course, is making sure that we have proper supervision if people are going to be doing something outside the classroom. So we are talking to quite a number of people. Some other programs have started, before us and have had some experience with this, and so we're going to learn from them. But at minimum, we're going to try to have practical case studies that people can analyze so that they can apply the skills they've learned in all the various courses. And it's a 4-credit course, so you produce something like a paper or various assignment steps as you go along.
Perfect. We have a student asking about the structure of the 8-week term. So if it's okay, I can kind of cover that a little bit. The classes start every 8 weeks, so there is not any specific breaks between classes except for the weekend in between. So we start September of each year. We only start in September. And with that, you go from September through, I would say, about mid to end October. Then you have the weekend, and then you start your next course from that mid to end October point through mid-December, and then you have a winter session break. So from that point in towards the end of December through mid-January, you do have that allotted time off. And then you go through classes again from January till March. You have a little bit of a 5-day spring break. And then you go again from March until mid to end May, and you are completed with the 1 year. So there is some scheduled breaks.
One thing that's important, we did have a faculty meeting today by coincidence, and just judging from the experience of people currently in the program, one of the issues that came up is that 8 weeks is very short. Most people are used to semesters, which may be up to 12 weeks, or 16 weeks, but 8 weeks is quite short. And we find that people who have not done online learning at all or recently sometimes have some challenges pacing themselves. So one of the things that's very important when you are doing our 8-week online course is to read all the instructions, put all of the assignment dates in your calendar, start listening to all of the lectures from the beginning and keep up to date on those. So it's very important to be disciplined in order not to fall behind, because 8 weeks is over before you realize it.
Absolutely. And while they're in the 8-week classes, I think it's good to point out, and it goes with a question that a student was asking about resources for when they do have questions and they are trying to work through assignments. Do they reach out to the faculty? Do our faculty very resourceful, teaching assistants? Like, how can they gain support through the 8-week classes?
Well, definitely emails are quite common. I tend to get them 24 hours a day because we have people in different time zones. All courses have at least one teaching assistant, sometimes more. One of the things, again, we discussed in our faculty meeting today is quite a number of people were asking questions of the teaching assistant and the faculty that implied that they really hadn't read, the information on the website. So quite a number of the questions people have about what to do, how to do it, the grading system, etc., is on the website. Each course has its own website with its own instructions, their pages for each lecture and each assignment. So the first step in terms of questions is reading the existing material so that you can answer your own questions. And then if there are challenges, you can email the teaching assistant, the faculty member, and we also have a discussion forum that people can raise issues on, and students and faculty discuss and answer each other's questions.
Perfect, perfect. And another great question that came up, and I can speak to this just from feedback that we've gotten from students, and please feel free to add in, Dr. Brieger. Students asking about the time commitment. You know, we're talking a lot about the 8-week classes. I would say a fair response as far as an average time when students have reached out and talked with us while they're in the program is typically about 18 to 20 hours a week if they are going through the 6 credits on average at a time. So obviously that's kind of a base to think of if you have 18 to 20 hours a week to be able to commit. Now, you are not required to be online at certain times. It's very flexible, it's asynchronous, so there are no required times to be online. But you will have deadlines to help keep you engaged and help keep you accountable. Dr. Brieger, would you say that's a fair assessment to about 18 to 20 hours a week?
Yeah, at least, because again, they're the readings and whatever. I mean, even I remember even as an undergraduate, they would tell us to, you know, for each hour of coursework, be sure you devote minimum of 4 hours to study, review, etc. I think again, it's very important for people to keep up to date with the schedule so that they know when things are due and pace themselves accordingly.
Perfect. I did have a question from a student who was wondering if you are able to, if their ultimate goal is a PhD in global health or international health, would this help them in that journey of getting to that end goal?
Well, basically, with a master's degree, you can apply for doctoral programs in any university. I don't see why that would. I mean, it's not directly tied in our case. That does bring me to the issue of courses, choices, etc. You know, again, this is a recognized master's degree, and you can use that to apply for doctoral programs when you complete it successfully. We do at present not have electives. So the curriculum that we showed you are all required courses. In the future, as we get more established, we find out what people's interests are, we may be able to develop some electives. But in order to get things approved, we have to, not only does the university have to approve of our programs, but the state of Maryland Higher Education Office has to approve of any kind of online learning program. And so they are very strict about the substitutions, courses, whatever. So basically, once they've approved our curriculum, we're pretty much fixed on that. We have, there's no connection between courses offered on the main campus and courses offered through Opal. So basically, what you see in the previous slides is what is required and what is available to you for now.
Wonderful. An application-focused question. A student was wondering about the application fee. For the master's degrees going through SOFIS, the application fee is $130. And going through SOFIS Express, the application fee for the certificate is $50. All applications for all 3 programs are open currently and closed July 1st. So the deadline ultimately to apply is July 1st. But again, if you do submit an application sooner, you can receive a decision sooner from the admissions committee.
Yeah, like I've already reviewed at least 10 applications, and there are 4 people on our admissions committee for our program. So people are already being admitted as we speak.
Perfect. I think this question is great for you, Dr. Brieger. With this being pretty newly designed and very specific focus with the Master of Applied Science, a student's wondering why they would choose this program over other global health programs elsewhere. What do you think differentiates this program?
Well, a number of things. One is the quality of production that we have, having one of the first schools to develop, online masters and postgraduate level education. Like I said, close to 25 years now that the Hopkins has been doing this. These are tried and tested courses that we've adapted from our existing curriculum. We also, obviously there is name recognition and in terms of your application for jobs in the future. We do have strict quality control in terms of our academic committees to approve any courses. They have to meet rigorous academic standards with proper learning objectives and learning exercises. So that's the thing. And again, like I said, we are the first department in international health in a school of public health in the U.S. So in terms of bringing those years of experience into the learning situation, in terms of SOFIS, you are allowed to apply for more than one program even at Hopkins. I've seen people who have applied for up to 3. I think 3 is the maximum. And some people will spend more money because you have to pay for, to apply for 2 or 3 schools at the same time. The big challenge is that when you get people to write your letters of recommendation, that they are as specific as possible, that you make sure that the people know you, that you've talked to them, and that they can also support your case. I mean, I don't know how many recommendations I read that say, Jane Smith is a nice person. That's not going to get you admitted. But if somebody says that Jane Smith, while she was in my course or my program or my agency worked hard on these community activities or these public health activities and has special skills in training and data management or whatever, that the person knows you and can say, what it is that, you can bring to the program and why you are motivated. Again, we don't want recommendations that just say you're a nice person. So again, so it works both ways. We offer quality, and we hope that you will present, your case in a quality way through the personal statement, as was mentioned, that you can really explain why you're interested in global health, and then also that your referees can also articulate why you are a good applicant for this kind of program. So like I said, both ways. We want to aim for giving you quality, and we want you to present, your quality to us.
Thank you so much. I think that naturally answered a few questions that we do have here. One thing I think we didn't get a chance to go over just was the experience of the online program a little bit more in depth. Someone's asking if we do have recorded lectures or do we offer any live sessions? And if there are live sessions, what happens if they can't attend one?
Okay, normally it depends on the course, but usually, every basic lectures are recorded, but there are discussion forums where people can interact with each other and faculty members, but then there are what we call live talks. So depending on the course I'm teaching right now, I have 5 live talks during the 8-week period. Another course we have 3. So these are actually broadcast at a given time, and you access it through the course website, which we call Course Plus. We recognize, of course, that people's work schedule, travel schedule, and time zone may prohibit them from being available at the actual time when it's broadcast, but every single live talk is recorded so that people can listen to it, the next morning.
Perfect. And would you say that there is a lot of internet-based readings, or is there a lot of textbooks that have to be purchased as part of the coursework? I know this will vary from course to course, but
it does.
The overall standings of the program?
It does vary from course to course. Basically, the ones I provide, what you need is, downloadable, what we call our online library. And so I think most courses have an extensive online library. They may recommend some if you are so interested to purchase some basic books. But I would say the majority of the material is available online, on the course website.
Wonderful. I think that gives a lot of great flexibility to our students that also travel for work, like yourself, Dr. Brieger. I know that you're out of the country.
One thing too, you can download the lectures and listen to them on the airplane or whatever else. Download them to your iPhone or what have you. So that's another option. We've have students who are going to be going out into the field where there's no electricity sometimes, or very little, and so if they download the lectures to their iPhone when they're out in the field for 2-3 days in a row, they can still listen to lectures.
Perfect. And I think the last question that we're running out of time here, so I want to ask this one last question that did come up in different ways a few times, and then we will make sure any other questions that are listed, we will reach out to you directly and personally here in the next few days through the Office of Admissions to assist in answering. Dr. Brieger, someone's asking, what qualities are you looking for when you're considering applicants for the programs? What are some key qualities that you're looking for? Is it professional, academic, experience?
All of the above. Yes, in terms of academics, I mean, that's one thing we consider, the person, I mean, generally people have a bachelor's and undergraduate degree. There are some people with additional advanced degrees, but they don't have anything in public health, and add that on. But basically, we're looking for people who have had some training that would be, or coursework that would have been in the area of human services. It doesn't have to be directly public health, because there aren't a lot of undergraduate public health degrees, but something that would show that, there is, some skill base in people. We have people in science, people in social science, but something that would be adaptable to and applicable to the kind of coursework we're doing. And of course, what happens is that people, then once you've graduated with your bachelor's degree, you would market yourself and you would then be working. So that in and of itself is the next most important thing, is have you applied what you learned in a health, welfare, social development, educational, social work, health, public health, educational type of agency, public or private or NGO. That of course is something that is helpful, because again, what we were talking about is that our initial getting into the certificate arena was to try to provide in-service upgrading for people who are already in the field, so that they could then have an actual certificate or degree. And so we're still aiming to help promote those continuing education skills, as it were, for people early and mid-career in the health, development, education, social welfare type of fields. So work is very important. In addition to work, we do, assuming you have the minimum of 2 years post bachelor's work experience, we in addition look at any kind of extensive volunteer work. Some people may have spent several months or several years doing some sort of a placement in Kenya, in Argentina, whatever. They may have done work in inner cities, where working with disadvantaged populations as a volunteer. So that's another thing that we're looking for. So whether it's through work experience or volunteer experience, we're looking for people who have demonstrated that they want to apply their skills, in these areas of health and development. So I think those are important. And then, like I said, that we do ideally we expect that people would have good grades, you know, and you know, these are all the different things that we're looking for, but we definitely want to see some sort of demonstrated interest in you know, in the health, especially global health, working with disadvantaged people.
Thank you, thank you. I think to piggyback off of that, we do talk to a number of different people with so many different backgrounds who have applied for our global health programs. So even if you feel like you do not directly fit into what's being described, if you want to talk offline about your background in particular, you're not sure what applies, please feel free to reach out to us directly so we can speak with you personally. Dr. Brieger's always been very kind to also connect with us to further discuss potential applicants. So please feel free to talk with us directly here in the Office of Admissions. At this time, we are going to have to close out the presentation. I thank you all for your attendance. There were a few questions that we're not able to get to this evening. We will be connecting with you offline. So someone in the Office of Admissions will be reaching out to you in the next few days. If you would like to speak to someone immediately, you can feel free to email directly. You'll see my email is listed here, as well as my phone number. You can feel free to call in tomorrow or send an email to me directly, and we'll make sure to reach back out as soon as possible. And for those who were just excited about this presentation, you see this as part of your future, please feel free to look at the scan codes here. They are specifically there to help you go to the next steps for the application process. We are currently reviewing applications, so feel free to get started and let us help you in that process. Thank you, Dr. Brieger, for presenting this evening.
And thank you all for joining us, and please tell your friends and colleagues about our courses.
Thank you so much, everyone. Have a wonderful evening.
Take care.